The Greens have called for a levy on junk food and alcohol advertising as part of a plan to cut Australia's growing obesity problem. Advertisers could choose to include health information in their advertising or pay that levy.
Richard Natale is the Greens Senate candidate. He launched the policy yesterday and joins us now in the studio. And also with us is Professor Boyd Swinburne, Director of the WHO Collaborating Centre for Obesity Prevention. Gentlemen, thanks and welcome to both of you. Richard Natale, tell us about the policy.
Well, essentially what we're proposing is that we introduce a levy of 1.5% on the advertising of alcoholic beverages and junk food. That levy to go towards funding health promotion. So that would include things such as promoting fresh fruit and veggies, things that are healthy, things that are essentially do exactly the opposite to junk food, that is improve people's health rather than make it worse.
What assurances do you believe are there that the big food companies will actually pay that levy, or in fact choose to pay that levy given their profits are quite big, and where that small cost?
Well, that's mandated by law. We'd make sure that that was a bill introduced into the Parliament. It's important to note that they spend, the junk food and alcohol industry spend in excess of $250 million per year. This would be a very small fraction of their advertising budget, but what it would do is level the playing field a bit. We've got this issue in this country where prevention has dropped right off the agenda. We've had this big discussion around health reform, but it really has been about hospital finance reform, and prevention has fallen right off the agenda. We've got to put it back on there, and this is just classic health prevention.
Professor Swinburne, what difference would a policy like that make?
Well, I think that over 90% of the public want something done about junk food marketing, and as Richard said, this is putting it back on the agenda. I think that it's starting to put the onus back on the junk food manufacturers and promoters to be able to provide something that's a benefit to the public rather than something that's doing detriment at the moment.
But as Michael pointed out, they've got such deep pockets that they'll just ratchet up their own marketing and advertising in support of their products. Wouldn't it be wiser to actually try and limit in some way or restrict the nature of their advertising?
Yes, the ideal thing is to have regulations to limit their marketing to children, and that's what a number of public health advocates have been calling for. But this is a very good first step to try and get it back on the agenda and try to get prevention of childhood obesity, which is affecting, overweight and obesity affecting at least 1 in 4 kids in this country, and we're doing virtually nothing about it at a policy level.
Richard Natale, what sort of warnings would you like to see put on junk food, similar to the ones that we see on cigarette packs now?
Well, essentially what we need to do is provide people with information. Let me go back a step and just say this is in conjunction with the restriction of advertising of junk food to young children. So this isn't instead of. Yeah. This is advertising that targets adults. The Greens have long supported the abolition of advertising of junk food to young children. We continue to maintain that position for all the reasons that Boyd suggested. But what we want to do is provide people with information. The amount of sugar that's in the product, the amount of fat that's in the product, and the amount of salt that's in the product. They're the 3 things that really do harm to people's health. And what we're just doing is providing that information. I suspect it would take the sting out of the advertising campaign of fast food companies, for example, if their glossy advertising budget was followed up with some reality, and the reality of what they're actually producing and marketing to young children and adults.
Looking at the politics of it though, what you announced yesterday and what we're talking about this morning, isn't it just exactly what people might be afraid of when it comes to a Labor and Greens alliance? You are about increased taxes. You're talking here about a levy, which is just another way of saying tax.
Look, taxation is the price you pay for a civilised society. I mean, I'm not going to get into this argument about all taxation's bad. We pay taxes because...
No, but these parties go into these election campaigns saying we won't raise taxes. You're basically saying today that in conjunction with a Labor government, because that's where your preference deals has been, you will raise taxes.
Well, what I'm saying is that if the Greens were elected and if we had a role in the balance of power in the Senate, one thing we would be pushing for is a levy just like this one. That is on corporations. Let's be clear about that. It's not on individuals. It's on corporations that produce those products that essentially harm people's health. Now, I think that's good, classic preventative medicine. As a doctor, somebody who works in this field, it's all very well to act at an individual level, but unless we tackle prevention at a population level, we're just not going to make the inroads that we need to. So, sure, I've got no problem saying this is a tax on junk food. It is a tax. It's on corporations, and it's a tax that it will improve people's health. The other thing to remember is it's an investment. We spend in the order of $60 billion because of the obesity problem, and probably in the order of $15 billion when you consider all the social, health and economic costs of alcohol. as again, the health system has to carry that burden. By implementing a tax like this early, we actually take the pressure off the health system, and in the long run, I know that's not what politicians like, they don't look long term, but in the long run this is actually something that will save us dollars.
Could this be a quid pro quo though, if indeed the Greens do hold the balance of power in the Senate and Labor is re-elected? Julia Gillard, you support this junk food levy tax and will support concessions on the mining tax or whatever other policy you choose to pursue?
In the Senate, we'll tackle each piece of legislation on its merits. We won't cross-trade one piece of legislation against another. We've done that consistently in the term of the last Senate. We'll make sure that each piece of legislation is tackled on its own merits. This is good public policy. It's got the support of a number of agencies. Vic Health came out just yesterday and said that they believe it's good public policy. Public health professionals believe it's good public health policy. This legislation stands on its merits, I believe.
Just finally this morning, Professor Swinburne, we've had successive federal governments who've both claimed to do something about childhood obesity in the last 10 to 12, 13 years. Would you like to assess actually just what has been achieved in terms of that issue or what hasn't? Has at least the recent federal government or the one before it done anything on this?
Very little at the federal level and very little at the policy level. There have been quite a lot of activities at the local level with schools and communities trying to rally support and try to get activity happening at the local level, but there's a real absence of a strong policy backbone to support this, and particularly to prevent all the undermining of the strong messages around promoting junk food. And it's rather unfortunate that the Preventive Health Task Force report really got quite a weak response, unfortunately, from the government, and things like banning junk food marketing to kids was put off for 2 further elections. That is a very long time in politics, and it really shows that there's a lack of commitment on the prevention side for preventing childhood obesity.
Boyd Swinburne, Richard Natale, thanks so much for joining us this morning.
Pleasure.
Thank you.
Thank you.
You're watching ABC.